All right, so I'm going to talk about more specifically about some of the interventions. The behavioral interventions are the ones that I always start with. And again, I always spend a good amount of time talking about how and why these interventions work, reminding them of that mind-body connection, and specifically how one intervention is going to help them with their pain. Because otherwise, it's just a whole bunch of psychobabble hogwash. They're like, okay, whatever. The very first one that I always teach is diaphragmatic breathing. And this one, I typically, when I'm introducing it, I make a joke because inadvertently, at some point during a kid's life or treatment, they have been told that when they've got pain, they need to take deep breaths and just breathe through it. And unfortunately, they are often not told how to do that because it's not regular deep breaths or why it works. So they've tried this technique, it hasn't worked, and it can feel very dismissing and invalidating over time. So I teach them that this is a special kind of breathing. With little kids, I call it magic breathing. And it feels very strange to do it first because it is not a normal, typical way that we breathe. So for example, when kids are take a deep breath or told to take a deep breath, typically they do it in their upper lungs and just way up here. And unfortunately, that's not the kind of breathing that is really going to help bring down those pain cycles. Instead, they need to breathe in where it is pushed down into the bottom of their belly. It might feel like they'll see their belly go up and down. I try to tell them to imagine a balloon being filled up. And it is challenging for kids to do this because it really is an unnatural or not typical way of breathing. And exhaling, the exhale is also a little bit different because you're trying to push what it feels like all of the air out of your body. So it feels like your body is empty and deflated and there's no air left in it. When I teach kids how to do this correctly and they try a couple, often I get these amazed expressions afterwards of like, wow, that actually helped, or whoa, that's really relaxing. So they need to know that deep breathing is a very specific kind. I also connect this with the physiology, and that this type of breathing, the one in your belly, not the one up here, triggers the centers in your brain that are involved with reducing that pain response. Older kids, I'll tell them that the parasympathetic nervous system gets triggered and tells the mind that everything's okay. With little ones, I might just say that tells the brain everything is peachy and it can turn down some of those alarm signals. Progressive muscle relaxation and imagery are often aimed at physical muscle relaxation. And again, I need to pair this with the whys. I'm not just trying to make them feel relaxed, but there is a direct connection between what we're doing and pain management. So, as an example, let's say that a kid has broken his leg. This is what I say to them. Your leg muscles are going to tense around that broken leg in order to keep everything protected and to try to keep that bone in place until there can be some sort of help. So that muscle tension is one of the things that triggers the pain areas in your mind and saying that we need to keep those alarm bells going so that you don't ignore this pain and you make sure to take care of it. So when you can physically force your muscles to relax, you are sending signals to your mind, to your brain, that the problem is less acute, less severe, and some of those pain signals can be reduced. Distraction is a very real and important technique for pain management. Remember, that's the prefrontal cortex of what we're paying attention to. That paying attention to pain, if it's the center of our life, then those signals are going to be increased. This one, there are times when there's some misunderstanding with distraction. That on numerous times, I have had parents and on occasion staff members say that a kid in the hospital they're exaggerating their pain, they're faking it. And their evidence is that when the kid is playing their video games, they can focus and they're smiling and they're okay. When they're chatting and talking to their friends, they're laughing and much more relaxed and having a good time. But then the doctor comes in and starts to asking them, and all of a sudden the pain is 8 out of 10 and they can't do anything. Or physical therapy comes in and tries to get them out of bed and it's just too much. So obviously they must be faking. But not necessarily, because distraction takes the attention away and can reduce some of those pain signals. Laughing and hanging out with your friends can increase positive feelings, such as that limbic system, and can also reduce that experience of pain. So there is a real physiological response that happens to that distraction. And when it's taken away, when that focus is back on the pain, the experience of pain might actually go up. Related to that, making sure to plan pleasant activities. Pain can become so central that kids stop doing the things that they enjoy. We want to make sure that we want to bring that back in to improve that quality of life and to make sure there's other things for them to focus on. And activity pacing related to this, one of the tendencies with chronic pain is to lie low when they're not feeling very well. And then on that day when things are okay, all of a sudden to do everything that they wanted to do, completely overdo it, and the next day have significantly more pain than they would have otherwise. So this is about teaching them to be realistic about how much they can do so that they can do things more consistently instead of these just bursts and absences.